right, thank you so much for creating time for us. Once again, we are talking about the youth and HIV, and this morning, you know that we are having this conversation because there's a lot we still need to do as a country. Kenya is still, not looking so good when it comes to the HIV burden. We are ranking position 8 globally. Today, as we speak, the latest numbers are that there are 1.3 million people living with HIV in our country. The prevalence among women remains high compared to men. The national prevalence is at around 3.03%. I have the acting CEO of the national, the NSDCC, who will be telling me a bit about whether this looks good or it looks bad. 3.03% as the national prevalence. I also have a young person in studio with me who is going to be speaking for the young people who have also raised a lot of concern when it comes to the new infections, that the burden still remains high among the young population. So I'm hosting this morning a panel of two gentlemen. With me in studio from the far right, we have with us Douglas Obosire, is the acting CEO of the National Syndemic Disease Control Council. And we have with us as well Christopher Amoyunzu, who is a youth advocate and a champion among the young people. He represents Maono Africa Center for Transformation, and is also somebody who has a very interesting story that he'll be telling us about what we need to know about how to live with people who are living positively, the stigma that is there in the society, and what young people need in terms of the information about HIV, how it should be presented to them, and of course, what needs to be done to be able to help them be part of this particular journey. Asante sana, gentlemen, for creating time for us this morning. And we want to start from, I mentioned a few numbers. I know there's a lot that we need to understand with regards to the latest statistics, but Wanasio, maybe it would be good to start, with you. And I was curious just to get to hear your thoughts on how the numbers look like, and that the person who is sitting sort of like in the driver's seat of some of these interventions. Where do you think we are going? How do we look? Is it a good place that we are at as a country?
Thank you very much, Safin, and thank you to the Royal Media and Citizen for having us this morning. Again, as a continuation of the discussions that we have been having nationally on the issue of the health and well-being of our youth. Safin, if you look at the HIV epidemic, since the first case was detected in this country back in 1984, it has metamorphosized. It has gone through phases. The 90s were very bad. The 1990s, there was a lack of treatment, there was a panic, there was a pain, there were deaths. The prevalence was as high as 10%. 1 in every out of 10 Kenyans that we met on the roads was HIV positive. Now, as you have said clearly, that has come down to about 3%. Back then, we were losing upwards of 700 Kenyans per day due to AIDS-related illnesses. But if you look at the statistics that we have from last year we lost about 21,000 Kenyans due to AIDS-related illnesses. If you look at the number of infections, for example, Safin, if you go back to 2005, we had about 94,000 new HIV infections in this country. Last year, we recorded 19,991 infections. Are we proud about that? We are happy with the progress. But as we always say, we are not going to confuse that progress with success. We do know that we are on a journey towards ending AIDS as a public health threat by 2030. And unfortunately, as we crack these numbers, as we see these infections, because that is our concern, we have certain subpopulations which are of concern to us.
The young people are particularly probably the one of those populations. Maybe you can talk to us about what's happening and why the focus is on the young population today.
Yes, and that's why I'm happy that today, Safin, you invited Chris to come over so that we can hear from the young people, from their perspectives, what they think is the problem. Because from where we sit, the data shows us that we have disproportionately large number of infections that are occurring among these young people. Out of the 19,991 new HIV infections that we had last year, 22% of them were among young children between 0 to 14 years. Unfortunately, 41% of those infections that occurred above 15 years were among adolescents and young people aged between 15 and 24.
41%?
41%. And Safin, worse still is that if you expand that bracket to 34 years, 75% of all the new infections occurred among that age cohort, 15 to 34. These are probably young people who are not born in the 90s. When we had the brunt of the epidemic, when we had the biggest pangs of and the pain points of AIDS as we knew it back then. But right now, you know, we have a very robust treatment program that has been put in place by the government with support by our development partners, and people are able to live healthy and longer, and you do not see any sign of opportunistic infections because of the ART program that boosts the immunity. Yeah, so the young people do not relate to AIDS as
of back then.
Exactly.
No wonder you'd hear people say when AIDS was AIDS,
exactly.
when HIV was HIV.
Exactly.
I don't know what that means, but it actually is sort of like if you
so you also belong there.
Yeah.
Safin.
Why do you keep insisting? Anyway, it's good that we have a young person on board. And Christopher, just as part of introduction, just for people to get to know a bit about you, because for you these are not just numbers, are they? This is something you've lived and you really understand where the shoe pinches.
Thank you, Safin, and thank you, Roll Media, for hosting us today. I'm Christopher Muyunzu. I work at Maono Africa, also engaged at Makadara Hospital with young people. With my lifetime, I was born with HIV and was identified a bit late. After my mother died when I was 3, then I was identified when I was 5. When everything was kind of rampant, my skin was tearing apart. I was diagnosed with skin infection, that is WHO stage 2. So the journey has not been easy, and I cannot testify with what Mr. Bosira is saying about how the thing is happening within the society. But what I can say about young people, you've said about the numbers of girls being higher than the men.
The women, yeah.
The women. This is because men don't access hospital, because this data comes from what is being collected within the facilities.
Oh, so it could be more.
It could be
That's
more.
What you're suggesting.
Yes, it could be more because us men don't have that tendency of accessing health services within the facility.
Tested, yeah.
Yes, and when you hear them, you find that they fear discrimination, they fear judgment, so they want spots where they can access services within the community for easy treatment plan. But whenever, if we could have them accessing the facility, you could see the numbers maybe equal or somewhere close to the ladies, because they don't, the record is not there. And we can't report something that is not recorded, you see. Yes.
All right. You were exposed to this life at a very tender age. This journey for you began at a very tender age. Maybe you can tell me a bit about what you've learned over time about HIV and what society, knows about HIV, just to bring out the contrast in terms of the misconceptions and the things you've gone through in terms of the lack of information. What you know vis-a-vis what people say or know about HIV.
So my journey has been kind of tough.
Yeah.
From when I was young, my mother died. I was taken to Mombasa, enrolled to an orphanage, and the orphanage was focusing mainly with positive children, and that itself is a stigma within that society. So whenever people come around, they just point and say, hawa ni watu wa
this
ukimwi.
group.
Yeah, this group, you see that word, ukimwi. And it will really tear us apart.
Yeah.
And at some point, I would say I was depressed because of the challenges that I was going through. Losing my mom, my only stronghold was my grandma. I lost her also. I lost a lot of people along the way. And me being a child, having skin issue, and also being HIV positive, it was too much for me to handle. So what I knew at that time, people, for me, I was masculine. I was just like normal children, you see, and I couldn't see any difference between me and them. And at some point, when I was 10, 11, I wasn't disclosed to, like, I didn't know what why am I taking this medication? So I decided to take a break. Like, I want to see.
So that you were not told why you're on medication until you were around 10?
Until I was around 10, because in the orphanage, you just go as a group to the hospital, take medication, come back. And no one is telling you about all these things. People don't have the capacity or that knowledge to inform you about what you're going through. So I stopped for like 2 years until now. It became a concern within the center, and now I was taken to a counselor and introduced this thing, and I understood that this thing happened. Of course, even if they gave me a wrong explanation, but at least it formed the basis of why I should take my medication at that time. Yes.
Now that you're into advocacy, why do you think, and it's not a problem only you went through, many parents usually find it very difficult to break that news to their children. Some do it out of thinking that it's out of goodwill, it's coming from a good place, but then it comes with consequences. Probably talk to us a bit about that challenge of lack of information and why it happens. Why can't parents just tell their children?
So most parents that I've dealt with or have worked with in terms of disclosing to their children, they say they have fear of unknown. Maybe the child will react badly, or they will run away, or they will hate them. So those are the things that parents out there, they are going through. So you'll find that someone will keep that information, or will entrust a healthcare provider to disclose to their children, which our guidelines say we can only support that disclosure, but the person who's supposed to disclose to that child is the parent themselves, because the child spends almost 95% with the parent. So it's best if they do it so that they can create that relationship with them. I know it's kind of hard. They feel like maybe this child is not too mature enough to understand these things. They will go and spread it to schools. They feel that if I disclose to my child will make them know my status, and hence they will hate me. You see, those are the fears that parents go through. But now, when in our advocacy space, we try and normalize this conversation and make sure and validate their feeling and help them, equip them with information so that they can be able to disclose it to their children.
I think they also fear the stigma, because the stigma is still real. Yes. The parents also fear the stigma that they themselves face, and also they fear for the child going into a society that is not ready to really embrace people who are living positively and even just understand that what sort of support they need. So the parents, out of fear, they feel like the right thing to do is to keep quiet.
Correct.
But then, Sio, you can talk to us a bit about the mother-to-child transmission. I was looking at the numbers. It kind of increased this year. We've made a bit of progress, but maybe you can tell us where we are at. Right now, it's at 9.26, increased to 9.26%, the latest numbers that we received. Talk to us about how that space looks like, and what are some of the things that are being done to really change these numbers and help parents.
Yeah, thank you very much, Safin. Before I just talk about vertical transmission, mother-to-child transmission, I want to take the opportunity really to congratulate Chris. And these are our heroes at the front line. A young person coming out and talking freely about his situation, about his password, he can encourage others. And if you look at Chris right now, you can't tell that Chris is living with the virus. And that is what we are saying, that this stigma, this discrimination, this human rights violation that we are subjecting people living with HIV is unnecessary. Because in this day and age, you can live to be 80 while living with the virus if you are on treatment and you adhere and stick to treatment. Now, last year, we had about 4,306 children who were, infected with the virus in a vertical manner from their mothers, mother-to-child transmission, 4,306. And you realize that most of these infections were as a result of either the pregnant mother not initiating themselves on treatment or not being initiated on ART treatment, antiretroviral therapy treatment, or dropping off treatment during pregnancy, or dropping off treatment during breastfeeding, or getting infected during breastfeeding. So you find that 2/3 of the mother-to-child transmissions are occurring at that very critical period of either pregnancy or breastfeeding. What else we know is that there was a lot of awareness, sensitization, and public education, particularly in the high burden counties. When you look at the geographical disparities between our 47 devolved units, you realize that when in the high burden regions, the ether to high burden regions for the HIV epidemic, we are doing very well in terms of prevention of mother-to-child transmission. However, especially in the northern frontiers, where we had no interventions at all, we had no programming at all, because the burden was extremely low. That's where we are seeing the spikes of mother-to-child transmission. We had about 5 counties that recorded mother-to-child transmission rates of higher than 20%. You have read the national, it's about 9%. But we had about 5 counties which recorded higher than 20%. Yeah, these are the counties of Isiolo, Garissa, Wajir, Mandera, also Samburu and Baringo. They are in there also. They recorded disproportionately higher.
What could be the significant challenge in that region?
The challenge there, one, is because this was not an issue, and therefore, when you encourage mothers to go for antenatal care visits when they are pregnant, when they feel they are pregnant, or when they test pregnant, they do not understand that apart from taking care of themselves and the baby, there is also a life-threatening infection that they might transmit to their children if they don't go for that ANC. We do know that out of the 83% pregnant women who seek fast ANC services, we lose about 38% of those before they complete their 4th ANC visit. And 2 weeks ago, we had a symposium, a workshop here in Nairobi led by our PS, just to discuss on what we can do to increase ANC attendance. And that is not only from the national perspective, but other counties, especially those counties that are lagging behind. Because the first thing for you to do is to be tested. Once you're tested, then you are put on treatment. So that has been the biggest issue, because they do not relate, they did not see. There was no programming, there was no awareness, and we are focusing on those counties particularly. They still have a low number. For example, a county like Wajir has only 701 people living with HIV currently. But then, if that number, if the new infections are not controlled, because it has a mother-to-child transmission rate of about 33%. If that is not controlled, then that number of 701 will double and triple in a couple of years' time.
All right. And let's talk about those years. And Christopher, there was concern about, if the young people don't know about their status, and we are living in a generation where the age of sexual debut is getting lower and lower. And it's not time for us to hide our heads in the sand. You deal with young people, you talk to them. Talk to us about some of the things that are happening within those spaces and the risk that is there, not just for people who were born with HIV, but just talk about what the young people are doing right now in terms of their sexual behaviors and their sexual activities. What are some of the things that we should be alive to today? It's not a season to hide our heads in the sand. Yeah.
Thank you so much for that question. And I think what is happening within the spaces, people are being exposed to early, not like previously whereby you'll find those days children were children, but these days you find that people are being exposed prematurely, plus also situations in life forces people to engage in activities that, for example, transactional sex, things like that. So with that exposure makes them at risk of maybe contracting HIV, and then also the information is within the facilities, within the centers, but in the community at large, you'll find that the information is not there. There's a place we went and we were talking about HIV, and everybody was like, oh, so HIV is different from AIDS. You see, there's that gap of information within the community. And according to Maono Africa, what we are doing something different that I think many programs are not doing, whereby we're using sports and arts to attract young people within the center, so that they can at least, you know, when you put a tournament, when you put a dancing competition, when you put an acrobat, people will come. And when they come, now that's when you take that opportunity to create awareness, to do testing, link them to facilities and all that. So if we have such things within the community, then I believe that we'll be targeting, we'll be reaching a lot of young people, because most of us, we are in centers, we are in hospitals, we are in spaces whereby young people don't want to reach or to come because of the stigma, because of the judgment, or because of the denial that they're having within the same space.
Do you think there's a generational gap between the parents and the caregivers and the young people in terms of information, in terms of even what they know about HIV and sexual and reproductive health, and how do we bridge that gap?
There is a generational gap. In fact, big one, because at Maono we have also a caregiver session whereby we talk with just the elderly parents.
Oh, so it's not just a youth affair. You bring in.
Sometimes we have to, because we have teenage mothers. So whenever we have that conversation, we just hear the way they're talking, like there's that gap between what is happening currently and what happened that time. So people still have that stigma. Doc here said about that stigma, that was there in 1990s and now. So still they have that fear of talking about this thing, even engaging the young ones about these health talks, like how do you handle yourself whenever you're in this situation. They feel stigmatized within themselves whenever they talk about it, because they have that fashion. And whenever you mention something, they feel like that's awkward because it's not within their ideology. You get. So there's still a lot of awareness needs to be done within the community, within those generational gaps, so that we can bring everyone on board. We walk in the same line.
See, the last time we had this conversation with you, something you said stood out for me, and he's bringing it out in his argument that, you know, HIV and these conversations generally are not just a health issue, they're actually a moral and a social issue, because he has talked about some people feeling like it's a bit awkward to suggest certain things, and there's that gap that is the reality that is there. So talk to me about how the conversations are changing, how the interventions are changing, how the narrative is changing to accommodate the fact that we are a very traditional society. There are people who tag religion in some of these conversations. How are you dealing with all those dynamics to come up with something that will work, because we need that on the table today?
You're right, Chris and Safin. In fact, we parents do not want to accept that we are the ones who are most stigmatized, even than the young people, around issues of HIV, because we want to assume that the current generation is living in our times.
That they can abstain, go to school, get good grades, get married through a white wedding.
When you look at when you look at the 240,000
but they can, right, Chris? They can. Can they?
They can.
Okay.
But with information. And that information has to be given to them appropriately and at an early age, so that they can make decisions. But how many of us sit with our children and talk to them about their sexuality? How many of us sit and tell them what the penis is used for, what the vagina is used for? We are very stigmatized, even just to talk to your kids. When we were growing up, we had uncles and grandfathers back in the villages, and grandmothers and aunties who used to take us through those sessions. Now we are here working in the city. Who will talk to your child? If you don't talk to your child, the internet will. The phone and the TV screen that you have at home will talk to that child. And they will engage, and they'll get all manner of perverts out there, and they'll convince them on what they should do and what they should understand. So I think the first, and as Chris has put it, really the family fabric has to resonate and has to protect the children that you have brought forth. The other sector that is very important to us, and we are working with, is the education sector. so that there can be some form of sexuality education, whatever name you call it. Of course, we want to call it comprehensive sexuality education. That's what we in the HIV space want to call it, so that it's comprehensive enough for this child to understand. And we are making advances. I really appreciate that the competency-based education system that we have right now, you can see elements of human, life skills and health education that are not telling you about this part of the body, but they are telling you about what that part of the body is used for. What are the functions of that part of the body, and when it should be used, because these children are in school for a very long period. Now, when it comes to a period like now, during the long holidays, I think these are sessions that parents really should take advantage of, not only at home, but also in the religious spaces, because one of the biggest pushbacks that we have had to matters of sexuality education is from the religious sector, the faith-based sector, where they feel that telling children about how their bodies are transforming is promoting.
Yeah.
But
suggestive.
It's a
suggestive intervention.
It's a suggestive intervention, but that's not real, because if we are having about 660 children between 10 and 19 falling pregnant every day in this country, it tells you that these children of ours are engaging in sex. And unfortunately, they are engaging in unprotected sex. And that unprotected sex does not only result in a possibility of pregnancy, but also HIV transmission and other sexually transmitted infections. Unfortunately, it also comes with school dropout. Because when you fall pregnant and you are 13, you will, even if the government has a mandatory re-entry program, but you'll have to take time off to go and bear the baby, to go and bring forth life. And when you're in that classroom, your concentration, your focus will not be on the math quiz that you have been given. Your focus will be on, has your baby fed? If the baby had a fever in the morning,
right, how
is she faring? So it interrupts, your whole life is distorted, and you're not given a fair chance, a fair shot in life, like the rest of us had. And we must protect these children.
All right.
Yes.
I'll come to you to talk to us about what's building up to the World AIDS Day. I know it's just a few days to that. There has to be something that has to change.
Correct.
So that next year, when you're having this conversation, we will not be having it the same way we are having it now.
True.
But then, Christopher, talk to me about, you had something to add to that?
I wanted to add something on what he's saying. You've talked about school program. It's good that you've mentioned that, because I was in boarding school, and there are a lot of challenges that young people or adolescents face within the school sector. The matrons are not trained for HIV programs, are not trained for TB programs. It's so unfortunate that 2019 I lost a young person who contracted TB within the school. No one identified it. Came back after she has done exam. The health deteriorated. She can't see, she can't hear, the hair turned. You see, this is something that could have been fast-tracked within the school. Those young people who are failing treatment within our facility come from boarding schools. So if we can create a structure or a package of care that teachers can take through the matrons or nurses within the schools, we can at least help curb this stigma that is within the school. For example, if you call me in a room and say, Chris, come and take a medication, and every day I'm coming there, or you come late as a matron, you are not doing justice to me, because I have time that I need to come for medication. I need to adhere to my medication. You need to understand all that as a matron. So those are the things that I also tried to talk to my sub-county and maybe treat the school, but the process is kind of difficult. But now, because I'm in this platform, it's good that you're here so that you can help me or help us to fast-track these young people within the school.
What about the relationship with the other students? How was it like being in boarding and being on medication, and what was the environment like for you?
So advantage with me is that I joined school when I was a bit huge. So no one could bully me easily. No one could bully me easily. And then I was confined with what I want. Like, I knew what I want. So there's no way you could come and tell me, do this, and I don't want. And then another advantage is that I go to school leadership in Form 3, deputy, so and president.
Give you a bit of power,
Give me a bit of power, even to protect those who are taking medication within the school. You get so, but those
what realities do others face? They may not have the same privilege as you.
Yes. So the problem that I had mostly is at the gate area where you are searched. Maybe the room is just small and it's accommodating 6 people. The gate man pours everything from your bag. It exposes. And then at some point, the gate man was saying, "Are you carrying bang?" You get. So I was so frustrated until I told the principal, this now is becoming so worse because now the students are within the place. So I was now told now to walk to the deputy directly to be searched, you get. But challenges occur. We find when someone is handing over the medication to matron, how they will coordinate, and then maybe if a student finds out about the drug, the stigma around it makes people uncomfortable. And I've had these problems with my young people. They complain about I kept my drugs in my drawer or my desk, and then someone came, take a picture, Googled, and find out that I'm positive, and then now I'm living hell in school. You get. So those are some of the challenges that are in school, and maybe we can have a structure whereby if this happens, what should be done? We need young people to be at peace whenever they're in school so that they can study and take the medication, not coming back with viremic or coming back with records that are deteriorating within health.
Actually, Safin, Chris is right on that point. Remember, even our children, when they go back to school in January, there is always a search. Before they go to their dormitories, before they go to their areas of residence, there's a search. And that search is done in the open. And unfortunately, if you are carrying your regimen of ARVs, they'll be exposed. And sometimes, whoever was searching, whether the matron or the teacher does not understand, then they'll start questioning this young person.
So what's like the proposed modest way of doing it?
Yes. No, confidentiality. We have to maintain confidentiality. So we are currently having a program where we are taking the matrons of the schools and the caregivers and the chaplains, and as well the class teachers. You know, each school has what we call a class teacher. That is what we intend. That is the ideal state. That even the class teacher who is responsible for that class understands his pupils, understands his students, so that he can empathize with them and can ensure that confidentiality is maintained. So that has been a big challenge, but together with the Ministry of Education, we are trying to address it. And it's through champions such as Chris here that really any other learner who is living with HIV can be encouraged to become a captain. You heard he became a prefect. He became
was a leader in his school.
A deputy school captain.
And right now he's using his story for purpose.
Exactly. Powerful.
All right. Yes. So talk to me about what's coming up before the World AIDS Day, and then there's a change of strategy in how you're doing it this time around. You talked about sports.
Yes, exactly.
There's a marathon.
Exactly. Now, Safin, I am happy about this conversation because it actually rhymes with what we have been feeling. That for a long time we could have been talking to ourselves in our own spaces, but not letting the young people give us direction. So these young people came last year and told us, no, we cannot just commemorate the World AIDS Day in a tent, in a hall, read a speech and go home. Let us create an environment where we can engage with each other, where we can share our stories in a transformative manner that is receptive and resonates with our unique circumstances. This year is on young people. Sports. We are leveraging the rich athletic legacy of the country to run half a marathon in Nairobi alongside other road races. So we'll do that on the 30th, which is a Sunday. We'll have a half marathon of 21 kilometers. We'll have road races of 10 kilometers, wheelchair race of 10 kilometers, so that people with disability are also involved. We'll have a family fun run of 5 kilometers. We'll have a corporate challenge of 5 kilometers. Like Royal Media, you can register as a corporate team of 20. You come and compete with the National Syndemic Disease Control Council, a team of 20. And whoever wins then gets recognized and gets awarded. And also a 2K. So we'll be having activities for young people, for the youth, and also for the adults, all in the name of creating a space for us to have this positive vibe, this positive conversation with whichever age cohort that we are.
So it's a race against time, quite literally.
That is the theme. That is the theme. A race against time on the 30th. But on the 1st itself, on 1st of December, we'll be having the county chapters in each of the 47 counties in Kenya. There will be a commemoration at each of the 47 counties in Kenya.
All right. Yeah. So I want us to finalize by just looking at, the way forward. And I'll begin with you, Chris. In terms of prevention and in terms of the interventions, what do you think the youth need, and how should it be packaged in a way that they relate with, for us to reduce the burden of HIV among the young population, as your parting shot?
For me, I feel that the youth need inclusion. They need also to, you know, we've said there's nothing without us. There's nothing for us without us, you get? So we need to be included in this policy development. We need to be included in this so that we can create a structure that fits us, you get? For example, there's a policy that binds a healthcare worker from giving contraceptive to ages below 17, you get. So such things, and then we are talking about teenage pregnancies. It's contradicting. So we can come up with policies that helps us access these things without any fear. Even the healthcare worker, at least to give out the service without any fear. And also, we have the health system. You've said a healthy nation is a wealthy nation, right? So if the young people are healthy, then we have something to celebrate about it, because now the health scheme that is within us, that's SHA, young people are complaining about it. Now that we are talking about integration, people have to go through the outpatient, they have to pay, they have to pay for the lab services. This is so frustrating to young people, whereby I am paying SHA. For example, I pay premiums monthly, but when I go to a facility, I have to pay cash. You get cash consultation, cash laboratory, cash medication, you get. So this thing is, I think we are retrogressing instead of progressing. Now that we understand the funds are cut, or there's no this support from the outside nation, then we need to find ways of how we can incorporate the HIV system within the existing system.
Thank you. Thank you, Chris. Your final words?
Yeah, I think just picking up from where Chris has said, I need, I think, to get a moment with him or something, just to understand on where this facility is that charges for consultation at the primary healthcare level, because you have heard from none other than His Excellency the President himself and our Cabinet Secretary that primary healthcare in this country, the outpatient services are completely free, and they are funded by your taxes and mine. So the primary health care under the Social Health Authority, this fund is provided for by the Kenyan taxpayers, and the government is very, very keen on finding out who are these unscrupulous facilities who are charging for outpatient facilities at that end. That having been stated, we must realize that it is the role of every member of society to end this multi-layered, overlapping challenge of the triple threat. It is our role to end new HIV infections, and we know the science tells us how we can end new HIV infections, end adolescent pregnancies, and sexual and gender-based violence. In our own spaces, whether you are a religious leader, whether you are a classroom teacher, whether you are a farmer, whether you are a border, whether you are a fisherfolk, it is our role in a multi-sectoral approach to have these discussions and end this triple threat, and we can do it.
All right. Thank you so much for creating time for us this particular morning as we are having a conversation around the burden of HIV among the young population. I've been having a sit down with Douglas Obosire, the acting CEO, National Syndemic Diseases Control Council, and also with us was Christopher Amuyunzu, Youth Advocate Champion, representing Maono Africa Center for Transformation. Asante, gentlemen, for creating time.
Thank you.
I know there's a lot we need to talk about, but there's a lot of activities also going on between now and the first, when the world will be marking the World AIDS Day. We have said we should get jogging and get ourselves ready and fit for the marathon that is coming. That could be your only way of being part and parcel of changing the narrative around HIV in our country. My name is Safina Chengoma. Thank you so much for watching the show this particular morning. It's a wrap for us, but keep watching Citizen TV.
Thank you.